Next thing we have this security rule. What does it talk about? So three things need to be kept secure. What are the aspects of the security rule? We have something called like CIA, confidentiality, integrity and availability. Confidentiality, you will have to keep the information secret. Without the consent of the wife, you are not even supposed to release the wife's information to the husband. In case a provider does, the wife can very well sue the doctor because she has not given a consent, and there should be a release of information. The patient should have surrendered a consent form to give the release of information. They'll have to authorize to whom they can release information. Okay, so it is very much kept as a secret. Without patient's consent, we can't do anything. If they say if they can hire an attorney, this is my health attorney, only to this person they can communicate all the findings. Otherwise, you can't share the health information to anybody else. Next aspect is integrity. Medical records, you are not supposed to tamper the health information. There are ways to tamper with. You will have to preserve the health information, medical records. It might be like 6 years. If a patient comes to your clinic, you might have to keep it for 6 years. And you'll have to see the federal laws also, or the state laws might also take precedence. That is also there. If state law is saying like you'll have to maintain for 7 years, you'll have to maintain information for 7 years. You'll have to keep it secretly. And when the patient is requesting for medical records, you will have to give. So availability. So providers have to provide the care, and if patients request for such medical records, you will have to give them. And without patient authorization, you are not supposed to release the information of the patient, except for TPO, third party organizations, or for government. And if it's something for this health statistical purpose, at that time you can release information. Otherwise, you are not supposed to release a patient information without their consent.